Hi, I'm Gwen,
And I'm Margot.
and this is Notes on Arrival.
Hi, everyone.
Hey.
So our last episode, Gwen gave us like a really helpful outline talking about unmedicated births. Today we're going to talk about induction. Um, why are we talking about this today? So the number of that are induced in the US is on the rise. Recent estimates are around like 30 to 32% of births. A 2013 survey said that more than 40% of women had their provider try to induce labor. I told my friend who's a doula that we were doing this episode, and she said to me, my only non-induction clients are the ones who go into labor before their due dates.
Wow.
Yeah. So my guess is that like it's probably even higher than 30 to 32% or 40%. And like that, those numbers are from 2013. I've also heard a lot of anecdotal evidence that it's like much higher since COVID.
Yeah, I've heard
Um,
that too.
So yeah, I'm curious, like Gwen, like what's your take? Does like 40% seem ridiculous to you? Like,
No, I wouldn't be surprised if it was higher, like you said. It's so interesting. Like, while preparing for an unmedicated birth, the number one thing that I was thinking about all the time was like, avoid an induction. Like, that's
mhm.
like the number one, I feel like, birth prep and like alignment with your provider that you need if you want an unmedicated birth is avoiding induction. Um, just because like I think there's so much that comes with that. And I know so many women who've had inductions for various reasons. I had a friend who had colitis who had to be induced, I think like before 37 weeks or something. It was like pretty
Wow.
early. Maybe it was right around 37. I had a friend who chose an induction after like 41 weeks. And it's interesting because both of them said to me, the one with colitis said, oh, for my next birth, I really hope I don't have to get induced. And she had like a pretty positive birth, but like I think she just really saw that like it creates so many other, things that come with that once you're induced and the risk of having all of those medical interventions. And then my friend who chose the induction at 41 weeks was like, I kind of wish I hadn't chosen that. Like I think in the
Mm,
time she was like, I really am ready for this baby. The doctor was encouraging her to do it. There was no medical reason besides just like being past due, quote unquote. But
yeah,
it's funny because in hindsight, she was like, I don't think I would choose that again.
interesting. Um, so I think like so today what we're going to talk about like in more depth is like what an induction is, what it might look like, what are some of the benefits to getting induced, and what are some of the risks. Um, And then like we have a little section on like when induction is a great option versus when your provider might recommend it. And like how to navigate the decision of getting an induction if like that's something that's presented to you. We've had a few women on who have had inductions, and we can link to those specific episodes in the show notes if you want to go take a listen. The second piece is like we are trying to be very objective with what we're talking about today. People have written books on this topic, so this episode is not comprehensive. If anything, it's just kind of like a springboard, we hope. And as always, like we are not offering medical advice. So like I said, we're going to talk about like when induction is a great option versus when your provider might recommend it. Like we are not saying don't go in for an induction if your provider is recommending it. We're just saying like this is some of the evidence on these topics, and like these are some things and like tools you can use to like ask questions and learn more. Primary resources for today's episodes are the American Journal of Obstetrics and Gynecology, Dr. Sara Wickham, her website and books, Evidence Based Birth, and the Mayo Clinic. So, like, we've done our research, we've fact checked everything that we're going to share here.
Wow, you're so much more polished than I am ahead of an episode with data.
I mean, this is, I like this
I
stuff.
also want to say really quick, like before you get into some of the facts,
Yeah.
while yes, this is not medical advice and we're not telling you what you should or shouldn't say to your doctor, I think one thing that we always try to remind women of is like it's okay to like do your own research and push back and question recommendations that you're getting from a medical provider. So,
Yeah.
like the doctor might be like, it's safer to induce at 41 weeks. And that to you is going to say, if I don't induce at 41 weeks, I'm creating a bigger risk for my baby. But like Margot's going to share some of the data as to like why that might be kind of like a squishy statement that doesn't actually apply to every person. So I think it's just like, it's okay to question things. It's okay to like push back a little bit. Not that I'm telling you what to do, but I don't know. I always encourage people to do their own research.
Yeah, absolutely. And if anything, like if any of this is of interest to you, like we can link to all of the resources in the show notes. Like I encourage everyone to like go do their own research. The other thing I will say is like while neither of us have had an induction, with my first birth, I was scheduled for an induction. And like I had done a ton of research, I knew a ton of things, and like had heard things of like women being like, I just didn't go in for my induction. It is a totally different thing to know these things objectively and to be told by your provider that you are increasing your like risk of having a stillbirth if you continue with your pregnancy. It is a really scary and really challenging thing to navigate. So like I think it's all about like listening to your gut and like doing the research and figuring out what's best for you and your family. But like I have been there. I haven't had an induction, but like I have been in the shoes of like my provider telling me my baby's going to die if I don't get induced. It's awful. And it's emotional coercion and manipulation and it's completely fucked and it needs to stop.
Agreed.
So I feel very strongly about this. I do want to share a quote from Dr. Sarah Wickham to kind of like set the stage for like how I feel about this and like when if this resonates, definitely. Share. But what she says is, I'm not anti induction. I'm anti using limited and cherry picked evidence and receptive claims about risks to try to persuade entire groups of women to hand over control of their bodies and undergo intervention in the name of safety when the recommendations aren't based on good science and don't account for the wider consequences of such interventions.
Yeah, I mean, I think that encompasses how I feel about most medical practice and data, to be honest. I think there's a lot of things that that could apply to. And I feel that
Yeah.
way most strongly about maternal health care.
Yeah. And you shared like your like two friends who got induced who were like, I wouldn't do that again. My neighbor told me, she said to me, she was like, getting induced with my daughter was hell. So I think it's like, it's like, oh, just get an induction because of whatever reason. I think that like a lot of women aren't fully prepared for what it is and what it can look like.
Yeah. And like both of those instances, like one was like medically necessary
Yeah.
and one was not. And it's like they both made that choice for different reasons. So I think it's like, like if you have the choice because it's not medically necessary and it's almost more of just like you're making that choice just because you feel like it. I think a lot of what you're going to share is going to help people like really make that choice a little bit more informed. I also think it's interesting, like as a society, there's so much like normalization around like it's eviction day, like it's this like whole
Yeah.
thing, like it's like this, oh, having my baby tomorrow, like people just like plan everything and you got into this like wanting control over like every part of your life and like it's just like it's not cutesy to be like it's eviction day because I decided. We shouldn't decide when baby comes. Baby should decide when baby comes unless there's a medical reason why we need to intervene.
Yeah, absolutely. Like this is something I say all the time, but like an induction is a tool, and it is a really great thing that we have it as a tool because there are medical conditions that like where mom can die, where baby can die if baby isn't born and like baby needs to be induced. Like that or the mom needs to be induced. That is like 100% true.
Yeah.
But like it's not true 40% of the time.
Yeah. It's also interesting too, like you were being pressured to schedule an induction. My friend at 41 weeks was pressured for an induction. But the average first time mom goes to 41 weeks in 2 days. So why are
Yeah.
we giving them a 40-week due date and then being like, well, if you don't give birth at 41 weeks, we need to schedule an induction? The chances are she's probably going to give birth in the next 2 days or the next 7 days. And the chances of the chances of things going wrong in that time is so low. Why aren't we just moving the due date? Like I feel like that would actually solve a lot of these problems.
Yeah, and we'll talk about due dates in a little bit, but that was one of the things that was so frustrating to me was like I switched to midwives when I was in my third trimester in my first pregnancy. And I was like, I was like, let's talk about induction. Like, what's this going to look like? And they're like, yep, we won't induce until 42 weeks. On my due date, I was there. I was at an appointment. They were like, okay, cool, let's schedule your induction. And I was like, excuse me, what the fuck? And it was just completely unnecessary. It was just,
Yeah, you're like, I don't even want to talk about that until next week.
right. And next week still would have just been 41 weeks. So it's like,
Yeah.
let's not even talk about that. And it's like, oh, well, we'll just schedule it. Like
Yeah.
that puts
And that's like a mind fuck.
it's a huge mind fuck. So what is induction? Just to start off super simple, induction is the artificial start of labor. We've talked on other episodes, like I think we've talked about this a lot about methods of like quote unquote natural induction. This episode is going to focus on like a medicalized induction taking place in a hospital. And then there's like a whole debate on like if natural induction is even a thing, but that is like,
Yeah, there's a
we're
lot
not
of
going to talk about that.
controversy around that too.
Yeah, exactly. Let's talk about like what an induction could look like. This is going to vary based on like your provider. If your provider is recommending an induction, like ask them to walk you through the process of what it will look like. This outline is from that I'm going to go through is from the Mayo Clinic's website. It's also very similar to what my midwife told me when like they recommended an induction. So like I think that this is pretty close to accurate, but again, like ask your provider, like, cool, I'm going to be induced. Like, what does this look like? So I was scheduled for an induction at like 9 p.m. on a Friday, which is like they will often ask you to come in the evening. So this means that like you and your partner and your doula, if you have one, are going to get admitted to the hospital, fill out paperwork. And then a lot of the times you'll wait because there could be women in active labor. There might be women in emergency C-sections. And like you aren't often a true medical emergency. So like, which kind of begs the question, like, if they're not getting that baby out of you now, like, why are you even there?
Yeah.
But we're going to get into that more later. First, like the provider is going to often start with what's called ripening the cervix, which are done using prostaglandins, which are taken orally or vaginally. Ripening the cervix basically means that like the cervix is going to soften and thin, which has to happen for delivery. There are two medications that are used for this. The first one is Cervidil. Cervidil is FDA approved for induction. The second one, which is what my provider was going to use with me, is called Cytotec. Cytotec is also known as misoprostol, and we talked about this on a previous episode, but misoprostol is not FDA approved for labor induction. Misoprostol is also commonly known as the at-home abortion pill, and it is not FDA approved for either of these uses. No company has set the FDA scientific proof that misoprostol is safe and effective for the use of cervical ripening and labor induction. It was approved by the FDA in 1988 for the prevention of gastric ulcers associated with the use of NSAIDs. So, like, if you take things like Advil, it increases your risk of gastric ulcers. So, it's approved for like the prevention of that. There is a black box warning on Cytotec that says Cytotec administration to women who are pregnant can cause birth defects, abortion, premature birth, or uterine rupture. So, like, why isn't it FDA approved for this use, and why is it like very commonly used? It's
How
because
did you
there's
find out
no.
they were going to use that for you?
I asked what they were going to use, and they told me Cytotec, and it wasn't
That's a great question to ask a provider if you're being induced. Do you think there's any way where like you can request the not the misoprostol, the Cervidil?
Cervidil. I mean, I think you can request it. I think like it doesn't hurt to ask. The only way I knew to it wasn't FDA approved was because my doula told me. So, like, why isn't it FDA approved? There's no financial incentive to getting it FDA approved for it. It's like, people are using it, whatever, it's fine. It goes back to like a whole thing when it comes to like women's health and like how we're treated by the system. Like, it's like, oh, like, yeah, we're just gonna use this. It's been shown to work, but like, it literally says on the box, it can cause birth defects.
Yeah, it's crazy.
So I think it's rare and like it is used very commonly with like effectively and it's fine. Just sharing the knowledge with
Just
everyone.
information that's worth knowing.
Okay, so they try to ripen your cervix. The other way that they're going to do this is they might use what's commonly referred to as a Foley balloon. The balloon is placed in your cervix, slowly filled with saline to add pressure to the cervix and allow it to ripen. Gwen, what have you heard about Foley balloons?
When I was pregnant with Frankie, it was funny. I didn't get any like discussion of induction when I was pregnant with Augie working with hospital midwives. And then at the birth center, where you'd think they'd be like, oh, like only worst case scenario, I felt like they at 40 weeks were like, not we need to schedule an induction, but like, oh, like we by next week we would have to schedule an induction kind of thing. And they were like,
Mm,
first, what we'll do at the birth center is a membrane sweep. If that doesn't work, we'll do the Foley balloon or Foley balloon. And then if that doesn't work, we'll do castor oil. And then if that doesn't work, medical induction is required. So from what I understand is like you just put it in and then it like opens your cervix. And all my friends who've had it said it's extremely uncomfortable and like weird.
yeah, that's what I've heard too, is that like everyone I know who's had it says they say it's extremely painful. And it makes sense, right? Like it's kind
You're
of
like
this like,
stretching your body.
yeah, yeah, exactly. The next step, like after that, is going to be the sweeping of the membranes, which you talked about. Basically, what happens there is a healthcare professional is going to sweep a gloved finger over the covering of the amniotic sac near the fetus, separating the sac from the cervix and the lower uterine wall. You had that done with both of your
I
kids, right?
did.
Yeah.
Yeah. I went into labor the night of the membrane sweep with Augie. I was a full week late. I was already 3 centimeters. Also worth mentioning that you can only have this done if you're like at least 1 centimeter. And I think even
Yes.
then, it's like that's hard. It's ideally you're a few centimeters. Both times I was 3 centimeters when I had it done. It worked immediately for Augie. It didn't work immediately for Frankie. I went into labor 2 days later. And from what I understand from talking to midwives and doulas who do this often or are around this often, it's not really inducing labor. If your body's ready to go into labor, it can kind of help to like kickstart the process. But if your body's like not about to go into labor, that isn't going to induce labor.
Yeah. Yeah, exactly. So, like after the sweeping of the membranes, the next thing that they're going to try is breaking the waters, which is also known as an amniotomy. This should only be done if the cervix is thinned, dilated, and baby's head is deep in the pelvis, or like if you have a high Bishop score, and we're going to talk about Bishop score more at the end. But rupturing the amniotic sac increases your risk of infection. The other thing is like when you break the waters, it's going to add a ton of pressure to the cervix, which is why it's done for induction. It's the idea is that like you add more pressure to the cervix, it's going to cause it to thin, cause it to ripen, kind of like kickstart labor. But it makes labor very intense very quickly. You no longer have that cushion between like baby's head and your pelvis. All of these things that I've mentioned thus far are help to help like prepare the cervix, but none of these techniques will actually cause contractions. What was interesting was I really wanted to avoid pitocin. We're going to talk more about pitocin. We talked about it on our last episode a fair amount as well. My midwives, when they were like talking me through like these are the steps, I was like, okay. And then they're like, yeah, and if none of those work, we're going to do pitocin. I wonder if like I don't know anyone who's ever been medically induced and hasn't gotten pitocin eventually. Do you?
Yeah. No, everyone gets
Yeah.
it.
Yeah, exactly. So like
Well, because
I
like your body's not ready to go into labor. So your
yeah,
body's not
exactly.
just gonna like spontaneously start having contractions because the cervix is now opened.
Yeah. It was like presented to me by my midwives of like, oh, we'll do all these things. And then if none of them work, then we'll get Pitocin. None of those things are going to work to like give you contractions. Um,
Unless it's the sort
so
of thing where like your body was about to go into labor anyway. Kind of
yeah,
like the membrane
exactly.
sweep effectiveness.
I saw something that like there's some evidence that shows that the membrane sweep can like labor will start like 24 hours earlier than it would have on its own. So
Okay. Yeah.
so Pitocin is the only thing that will like actually cause contractions, the only like medical thing that will cause contractions. It's synthetic oxytocin. Gwen told us a lot about oxytocin last time, but just quickly, it's the love hormone. It's released when you have an orgasm, when you're nursing, and it's released to contract the uterus during labor. There's a book that Gwen and I got 2 copies of. So I gave one to Gwen called Oxytocin, the Biological Guide to Motherhood. It was really interesting, very scientific, kind of like a dense book, but I would say like oxytocin is fascinating. And if you want to learn more, I would definitely check out that book. I don't know, Gwen, if you read it or anything from that book that like stood out to
I've
you.
kind of like thumbed through it. It's sort of like a textbook.
Yeah.
And I'm not like a huge school nerd like you were. So I see that and I'm like, I'm good.
Yeah. But basically, like very briefly, oxytocin is associated with pain relief and it also counters the effects of cortisol, which is the stress hormone. Oxytocin will cause the uterus to contract in waves. I'm curious, Gwen, if you can tell us a little bit about like what a contraction is like when you're unmedicated. What is that like? What is it like to have a contraction?
I mean, it's kind of just like your uterus is like contract. Like think about when you're like lifting a weight and your muscle is engaged and it kind of is like tensing up. It's like your uterus is doing that, but there's just like so much pressure because you're not doing it. I don't know. It's kind of hard to explain, but I would say like physically it kind of feels like you're flexing, like that uterus is flexing on its own. And it just feels like a lot of pressure. Like you're pushing the baby, you're pushing everything in your body. At least for me, like I just felt like there was always like this really intense, just like pushing, like in my whole like core of my body.
And was that like continuous? Was that just like what it felt like when you were in labor?
I mean, when I was contracting, but like there's always breaks between. So it's kind of like contraction, and then it kind of like waits for a minute, and then contraction, and then it waits. And then obviously those contractions come like, they're further apart at the beginning, then they're closer together. When I went into labor with Frankie, I had been contracting like every night for like honestly weeks. I was like,
Ugh.
would lay down, I would like feel a bunch of contractions, just like a lot of cramping. It kind of feels like both times I started labor, it feels like period cramps. You're like, oh, I have a cramp. Like when you have your period, especially when you're like a young teenager and they're like kind of really intense, it feels like that. And then it starts to like really surpass that feeling to like the most intense cramp you've ever felt. But when I was in labor with Frankie, I had already been contracting every night for weeks. And I was like, oh, like more contractions. And then they like kept coming and got more intense and like were coming consistently. And I was like, oh no, this is like actually labor, not just like random nighttime contractions.
So the thing that you touched on that I really want to like highlight as one of the biggest differences between oxytocin and pitocin is that like your body is very smart. So like yes, oxytocin will contract the uterus kind of like in these waves that like come and go and you get breaks in between. Pitocin isn't like that. Pitocin isn't like it's just like not administered in that way. It's like given via IV, so it's in your bloodstream. So it is continuously putting that pressure and contraction on the uterus. So it's kind of like one sustained contraction, which makes it much more painful, much more intense.
And also much
Um,
more risky for the baby.
100% and more risky for mom. Your risk of uterine rupture goes up with Pitocin.
Wow.
The other thing is that Pitocin doesn't cross the blood-brain barrier, so it doesn't have any of the positive feel-good effects that you get with oxytocin. So there's no interaction with cortisol. There's none of the like feel-good stress relief that you get with oxytocin. All that is to say that Pitocin is fucking intense. And most women, I don't have the numbers here, but like anecdotally, I only know one person who had Pitocin and didn't get an epidural, and that was because she like has a genetic defect that she wasn't like it wasn't safe for her to get an epidural.
What about you?
Um,
Didn't you have Pitocin during your first?
I did. For an induction, I should say. I had
Okay.
Pitocin for the last 45 minutes of my labor, and I didn't feel a difference, I will say, but I think
Okay.
at that point it was like
It was already very intense.
it was already intense. I'd been in labor for so long that it wasn't like it helped my contractions come more quickly at that point, which was good, which was kind of like why they gave it to me because my contractions had started spreading out because my body was so tired.
Yeah. My mom had Pitocin without an epidural with my sister.
That's that's crazy. So a lot of women are going to get an epidural at some point
Yeah.
with the Pitocin because it is extremely intense, very painful for all of those reasons. We talked on our last episode about like what an epidural looks like. There is this kind of like vicious cycle that happens when you're being induced, which is like you get the Pitocin and then it's very intense, very painful. Mom might have a hard time coping. She gets the epidural. And then the epidural causes her to relax too much. So now we're upping the Pitocin and we're upping the epidural because it's more intense. And then it's like kind of like these things like go in this vicious cycle until the baby is born or the provider deems that a C-section is necessary. So that is what an induction can look like. It sounds awful.
Yeah, I was gonna say it sounds like a lot of the like stories that I've heard from friends, that is what it's like. It's like you get the Cervidil or you get the balloon and then you wait. And then you get the Pitocin. And then usually, most women I know got the Pitocin and an epidural like simultaneously, essentially. Like not
Word.
even waiting to see if they could manage because they were just like, I know that I can't. And
Yeah,
honestly, if I was required to get Pitocin, I might make the same decision.
100%. I don't think that, like, I've heard from a lot of women who have gotten induced, like, oh, I couldn't possibly go unmedicated. Like, it was so intense. I'm like,
I've heard that
it is
too.
not the same thing. Like, you
Yeah, they'll
did
be like,
not,
how'd you do that? I'm like, I didn't have Pitocin like you. Like, I
right.
probably would have had an epidural if I had Pitocin also.
Yeah,
Like,
I fucking think so. No, it's not like any woman who goes unmedicated with a Pitocin or doesn't get an epidural with Pitocin, like, you are like God among women. Like, you are next fucking level.
that's what I was saying in the very beginning. Like, that's why, like, for me, like, knowing I wanted to be unmedicated, I was like, I need to avoid induction because
Yeah.
if I don't avoid induction, it's going to be really hard for me to go unmedicated. That to me felt like the biggest challenge. And as long as I could avoid induction, I would most likely succeed. And I believe that's probably the case for most women.
Yeah, absolutely. Like I said before, like there are times when induction is a great option. So if there is a medical condition that is affecting the mom's health, induction is a fantastic option. So an example of this could be preeclampsia.
Yeah.
Preeclampsia is defined by high blood pressure or hypertension, usually about like 140/90 or higher on two separate occasions, at least 4 hours apart. So that's like part of the diagnosis. The other part is that there's often protein in the urine, but diagnosis can be made with or without the protein in the urine, dependent on like other symptoms. Preeclampsia usually develops after 20 weeks of pregnancy, but it can also occur postpartum. And preeclampsia can cause damage to the kidneys, liver, brain, blood clotting. It can also lead to conditions like eclampsia, which is seizures, HELLP syndrome, which HELLP, which is a severe form of preeclampsia, and stroke. So, like, you can also, with all of those things, you can die. So, this is
Yeah.
like a very serious thing.
There was a
The
couple years
only,
ago where an Olympian died from preeclampsia.
really,
Yeah, I'm
oh,
trying to remember what
wow.
her name was, but it was terrible. I mean, it's a really really scary thing to
Yeah.
like experience.
Yeah, very severe. Like, this is a very serious condition and, like, a time when, like, absolutely it should be, an induction, like, is the best option because it will save the mother's life. Another time when, that's a great time for induction is when the baby has a health problem or condition that will get worse if they stay in the womb for longer. So if the baby has some sort of condition that can't be that, like, where they need surgery, where they need something that, like, they can only get outside of the womb, induction is a very good option. One of the things that's crazy, and we're gonna get into now, like, why your provider might recommend an induction. The standard protocol for gestational diabetes is induction. It's something that I've heard, like, very commonly, I'm sure you have as well.
Yep.
There is no evidence to support that, getting induced, like, actually improves outcomes for mom and baby, um, with gestational diabetes.
Yeah, I have heard that. And I actually know some women who've been induced because of gestational diabetes and they still were able to do an unmedicated birth. One of them was induced and unmedicated, and one of them actually, no, she wasn't induced. She went into labor a little bit early and she like birthed in like 5 hours. I was like, damn, good for you.
Wow.
Um, Another, you might be mentioning this, but another common recommendation is inducing a woman for a VBAC, inducing her early.
Yeah, so, I talked about how, like, pitocin increases your risk of uterine rupture. And, like, I have a very small note here. So yes, VBAC candidates can be induced, but you have an increase if you've already had a cesarean, you're at increased risk of uterine rupture. So, like, I hadn't heard that like VBAC candidates are induced.
I shared with
Is
you yesterday my friend who had a
yes.
successful VBAC recently, and her OB was recommending induction at 39 weeks. And she had done a ton of research because she was planning an unmedicated birth for her first, but because of medical reasons had to be induced, or sorry, because of medical reasons had to have a C-section. And so she
Yeah.
was like really, really committed to doing a VBAC unless there was a medical reason she couldn't. And the OB was like, we're inducing at 39 weeks. She did a ton of research. She got second opinions from midwives and was like, I'm not doing that. And pretty much just went directly against the recommendation. She went to, I think, 10 days past her due date, and had a baby and had her VBAC. And yeah, everything was good. I mean, it was a challenging labor, but like she safely had her VBAC. And in my opinion, that's probably a safer way to have a VBAC versus giving Pitocin to a uterus that already has an increased chance of rupture.
Why was the provider like, what was the medical indication for an
I
induction?
don't think there was a good one because based on the research that she did, she was just like, I'm not taking your recommendation and felt confident enough in her own research and didn't feel like the doctor had like a good medical reason, which I think
She's
goes back to what we were saying. Like, don't just listen to what you're told all the time. Like, be like, what is the research? What is the reason? Like, there's a lot of just like sweeping averages and sweeping recommendations, like, oh, VBAC, do this, or oh, gestational diabetes, do this, without treating every woman as like a unique case that she is.
Yeah, it sounds like her provider, like if her provider was like, "Oh, if you want to try for a VBAC, like we should induce at 39 weeks." That sounds like the provider was thinking about the Arrive trial.
Yeah.
Which like
Oh, fuck
we're
that trial.
yeah, fuck the Arrive trial. Which so I'll mention this here briefly. So there was a study called the Arrive trial that claimed that induction at 39 weeks severely reduce the likelihood of C-sections. There are many, many issues with the way that the study was conducted. We're not going to discuss them in full here. Evidence-Based Birth has a great resource on this if you want to learn more. But the short thing to know is that real-world studies attempting to replicate the findings of the ARRIVE trial have actually shown contradictory results, showing that like induction groups have higher rates of cesareans, 30 versus 24%, than lower. And it also, the ARRIVE study does not mean that elective induction at 39 weeks lowers the risk of cesarean for every single individual. This is particularly true if your provider has a high C-section rate. So like induction at 39 weeks, I mean, like, one, it doesn't like make logical sense to me. Like, why are we like how is it possibly safer for the baby to like have a medical intervention to jumpstart labor versus like letting the baby cook for as long as they choose to?
Especially when most
Um,
women will go to 41 weeks anyway. Like that's 2 weeks early.
Especially for first-time moms,
Yeah.
right? I think your friend sounds like an absolute badass, but to really push and be like, what are the risks? What's the medical indication? We'll talk about that more too.
Actually,
What
I
are
just saw what I just read back to see what she said to be like, was there something? It was because of the size of the baby, which I'm sure you're gonna get into.
let's talk about this. So what are some of the reasons why your provider might recommend an induction? Induction for suspected big baby is what happened to me too. It was because I was like late, and we'll talk about induction for due dates too. But it was because I was late and he was suspected to be a big baby. So this is the one that, like, because it happened to me personally, is the one that infuriates me more than anything else. And I think goes back to like what we've talked about, which is like a way of like controlling mom and baby, and a way of saying like you can't do this. So third trimester ultrasounds, first of all, can be off a pound plus or minus in either direction. So like
Full pound.
they're yeah, a full pound.
When you're talking
Like
about babies that are like 7 pounds, that is a massive discrepancy.
yeah, 6 to 8 pounds is a huge difference.
Yeah.
So like my son at 34 weeks was measuring at 7 pounds. So at 34 weeks, like at the end, all your baby's doing is growing. So they were like, oh my God, like he's just gonna like keep getting bigger. And I was like, I'm not having a 10-pound baby. I was 8'5", my husband was 7 pounds something. Babies are often kind of like in between your two parents. And like, so like, first of all, like the ultrasound measurements are wildly inaccurate. Second of all, um, I am a very firm believer that 99% of women are not going to grow a baby that is bigger than what they're physically capable of giving birth to.
Yeah. The instances that I've read of that are like extremely rare, like way more rare than any other like potential birth risk, like way more rare than preeclampsia or other things that really aren't that common.
Yeah. And like the thing to think about there is like, if they're suspected that the baby is too big, why induce? Just schedule a cesarean. You're not going to be physically capable of giving birth. Obviously, the reason that they're recommending induction is so that the baby doesn't get any bigger. But like, it doesn't.
Yeah. Also, I know so many women who've been induced for this reason, and they're always like, yeah, they said the baby was going to be like 10 pounds. Then it came out, he was like 7. And I'm like, yeah, no shit. Like, I feel like for me, this is the one that like really bothers me because I'm just like, those measurements are not accurate. And like,
Yeah,
it's really just in the interest, I feel, of controlling the situation.
100%. So the risk, why are we concerned about suspected big babies? The risk is shoulder dystocia. But research has shown that the incidence of shoulder dystocia is only marginally higher for big babies. Like you can have shoulder dystocia with a 6 pound baby. Shoulder dystocia is when the shoulder gets like stuck on the mom's pelvis, which is like a complication and is a serious thing that can happen. And you need a provider who's trained at handling shoulder dystocia. There's like methods and ways of like moving the bomb to like get the shoulder out. But like that just means that the providers just need to they need to do their homework.
Yeah. Yeah. And I think just like need to be trained in like different occurrences that could happen during a natural birth.
Yeah, absolutely. The other big thing is like being near or past your due date. So like I said, for me, it was like a combination of I was like past my due date and suspected big baby. Sarah Wickham's book, In Your Own Time, goes into this like in much greater depth. So I'm not going to get into it now. But here is a fucking fact for you, for everyone listening. The 40-week standard of like due dates comes from a 19th century male German obstetrician observations of what was a fairly homogenous population based on the assumptions of standardized menstrual cycles, that doesn't reflect the reality of individual variation. So basically, there was some guy in the 1800s who was like, oh, seems like most women give birth around 40 weeks. This is
Yeah.
assuming you have a 28-day cycle. This is assuming that you're
In
German
the
in the
19th
1800s,
century?
19th century, so
Okay.
1800s, yeah.
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 And how much has
Um,
like changed in like our like the average of like women's bodies and like our health and nutrition and environment since then? Like there have been so many massive changes in society. Why are we basing that off of this?
Great question. The other problem is that like dating is really problematic. Like dating is either going to be done under early ultrasound or like based on your last menstrual cycle. Like how we get to the 40 weeks is like 40 weeks as a standard is based on this. So like there you fucking go. And secondly, like the way that we're dating and getting to a due date like isn't also necessarily scientifically accurate or like precise. So like you said, like we have these eviction dates for babies that like is completely based off nothing.
This
Like,
old
not
German
nothing.
guy.
This old German guy. Like, why are you going to dictate that, like, oh, my baby needs an induction because, like, I'm past this due date that this guy said over 200 years ago? Like, no,
Is there anyone in the birth space or the medical space who's working to change this and update it?
not that I know of.
Because someone has got to step up. It's not going to be us because we don't have like the medical training and, clinical experience, but I just feel like why isn't this being like updated? Why isn't it being addressed? Why is it that you'll go to the like your annual like wellness visit and they'll ask you how long is your menstrual cycle? And then you go and you tell them you're pregnant, and maybe they ask you that, but then they don't adjust your due date based on how long your menstrual cycle is. Because anecdotally, I feel like there's a direct correlation of how long your cycle is and how long you gestate.
Yeah, like both of my kids were past due and I have a longer cycle.
Yeah, same.
So, um, of moms who were induced, 62% have said that it was because the baby was full term, near due date, or past due date. So, like, this is very common. And the one that, again, like, you're not going to get a good reason for. We talked about gestational diabetes. The other reasons why a provider might recommend induction are you're older, you're heavier, you have higher BMI, you have high amniotic fluid, you have low amniotic fluid, and my new favorite, you have suspected small baby, which is like, what? So why are we going to take the baby out
Wouldn't you
sooner?
want to leave baby in longer and like ideally try and keep mom pregnant for longer?
Yeah. And then another reason why they might recommend induction is if your waters have broken and labor hasn't started after 24 hours. Now, here's the thing with this is that they say that it increases your risk of infection. That will happen the more like foreign substances you introduce into the cervix are going to increase your risk of infection. So your waters can be broken and you have random people sticking their hands up there. Yeah, that's going to increase your risk of infection. But like if no one is putting anything up there,
Yeah.
I don't know that the evidence continues to support that increased risk of infection.
Yeah.
So there's lots of reasons. I think the most important thing is like if your doctor is like recommending an induction or your midwife, like ask them why, ask them and like ask them what the evidence is to support their reason. We can
Yeah,
get
ask them
into
for
more.
resources. Like, where can I research the data
Yes,
that like this recommendation is based on? I just want to like really understand what the pros and cons are.
yeah,
Because you might do the
absolutely,
research and be like, I actually think this is a good option. I'm going to do it. But you
100%.
might also be like, no, this isn't based on anything. I'm not doing that.
Yeah. So benefits of an induction. One is like if there is a medical indication, induction like can save your life, 100%. Like let's be very, very clear on that. It can also prevent like the worsening of medical conditions like preeclampsia.
Or like my
Um,
friend who had colitis. I don't think that's
yeah,
life-threatening, but I think it was enough of a medical reason because it's like I think damaging to your liver. So I think
yeah,
it just like mitigated the damage that she had for her body.
yeah, absolutely. Induction also allows for planned controlled delivery timing.
I know
So
someone who did that for their second so that they could have a babysitter ready for their first.
yeah, like that's a real thing. So like when it's the right call, it's a great that we have this as a resource. Risks of induction, we talked about how it can be more painful. Elective induction before 39 weeks increases the risk of breathing problems, infection, and NICU admission for babies. Elective induction is when like there's no medical indication. Induction has an increased risk of cesarean birth, especially for first-time moms. There's increased risk of low fetal heart rate due to stronger, more frequent contractions because of the pitocin, higher risk of infection for both mom and baby. There is a rare but serious risk of uterine rupture, which we talked about. You also have the risk of the cascade of interventions, the epidural, continuous monitoring, etc. Induction has, and like those are all pretty like serious, kind of scary risks. The other thing is that induction has been shown to be associated with lower breastfeeding success across a variety of studies. And this is because of like the impact that synthetic oxytocin has on the body.
Interesting. That doesn't surprise me. I wonder too, and I don't know if you have any info about this. It's a little bit squishier. There might not be like a solid number, but I think just like satisfaction of like a birth experience and birth outcome, I imagine it's much lower for induction
Yeah.
just based on what I have spoken to women about who've had inductions versus not. Which obviously like really at the end of the day, it's like we want to make sure like everyone is healthy and that like you don't have any, severe injury and the baby is doing well and everyone's alive and all of that. But
Yeah.
also that's a relatively low bar. Let's also like consider that this is a transformative moment. How can we make it a positive experience for mom and baby? And how can mom come out of this feeling empowered and happy and joyful versus having birth trauma, which is a real thing. We've talked to a lot of women who've had that.
Yeah, definitely. And I don't have the numbers on it, but I think that like that's kind it's sad that we're in this position where like that's the standard. Like I hate we didn't talk about this on our unmedicalized birth episode, but I hate when people are like, "Oh, I just like I want a healthy like I want to be healthy and for my baby to be healthy."
Yeah,
Of
like
fucking
people will be like, my
course.
birth plan is to me and baby to be alive. And I'm like, that is such a low bar. Like the chances of that are very high. Like
Yeah.
you could just go in and have a C-section. Like and you'll most likely both completely survive that and be fine. But why wouldn't you want to go in and like have an experience that's like the best possible experience that you could have, like emotionally and physically?
Yeah, absolutely. So let's talk about like your provider, your like however many weeks your provider is coming to you and being like, I'm recommending you get an induction. We should have your friend on who like just had her unmedicalized birth because I would be very curious to like it sounds like she did a ton of research and like
I
got second
know.
opinions,
I
which
was
is
just thinking that.
amazing. Yeah. One tool that my doula from my first birth gave me, which like I think is a good tool for any part of like navigating any medical decisions, but like especially in childbirth, is use your brain. So what are the benefits? What are the risks? What are the alternatives? What is my intuition or my gut telling me? And what happens if I do nothing? So like I love that as kind of
Yeah.
a framework to think through and push back. We talked about some of these as well, but like other things to consider are being why are you recommending an induction? And what is the evidence to support getting induction for this reason? And then also like ask about the what would be the process if I choose to get induced? Like what would the process look like?
Yeah.
The other thing that I would say is like get your bishop score. So your bishop score helps determine if you're a good candidate for induction. It's based on how dilated is your cervix, how effaced, how soft is your cervix, how far forward is your cervix, and how far down in the birth canal is your baby's head. The higher your bishop score is, the more likely that the induction is going to be successful. So like really good things
And
to
can
ask.
you just like ask a provider to
Mhm.
take those measurements and then you can make a decision based on that?
Yes,
And that's
absolutely.
not standard to do that ahead of induction recommendation?
I don't believe so. The thing that's crazy is like we think about dilation and like dilation isn't a like crystal your cervix isn't a crystal ball to like when your baby is going to be born, but like it's when I was being recommended an induction, like I kind of pushed on this and was like take my bishop score and this or that. Baby was super high up. I was like 1 centimeter dilated and I was like I know when I got to the hospital when I was in labor I was 100% effaced, but like if I had gone in for an induction it wouldn't have been successful.
Yeah.
So that's induction. So the induction rate has more than doubled since 1990. So in about like 35
Wow.
years, it has more than doubled. And the increase hasn't been attributed to like a similar rise in medical conditions. Like women are not being diagnosed with preeclampsia twice as more frequently as they were in 1990. So I think it's like a way for providers to have control. It's a convenience factor. Um, Inductions are far more likely to happen around the holidays and around,
Love that one.
Christmas and in the summer. So I guess like Gwen, like closing comments, thoughts for anyone kind of like in this position.
Yeah, I mean, I think like two main things. One, like I kind of already started the episode saying this, but don't be afraid to like ask more questions, push back. I think you shared some really helpful information about like asking to have your bishop score taken. Use your brain, and in both senses of the word. If
Yes.
it doesn't like feel right, I mean, I guess that's like the instinct or intuition part, but it's like if it doesn't feel right, you should question it. Like, honestly, you're the only person who really knows what it feels like to be in your body. And that's more so the case during pregnancy than ever. Like you need to be able to say, to question a recommendation and ask for more information. And also say, I'm going to do a little bit of my own research and let you know, like, what I want to do or how I want to proceed. So I just think, like, that's probably the most important thing here. And I think, too, like, like, let's stop normalizing a non-medical induction and having this
Yeah.
like eviction notice, baby's coming today. Like, look, for a medical reason, absolutely. Like, let's have those inductions. Let's save people's lives. Let's make sure that baby's safe. But I think like majority of inductions are just kind of out of convenience for the mom or the provider.
Yeah, definitely. I do want to say that, like I said, I was in this position and it was really scary where they were like, you're past your due date, your baby's gonna be 10 pounds, and he was not. Um, and they played the like dead baby card on me. They were like,
Yeah.
your son is going to die. It is awful. It is medical coercion. It like
Yeah.
those it is a really, really awful situation and position to be in. Um, one of the other questions that you can ask is like, what is the absolute risk? So like,
Yeah.
and I think that that makes a big difference. Like they'll say to you, oh, stillbirth goes up twice as it's twice as likely, but the numbers are like very, very small comparatively.
Yeah.
Um,
If it's like 0.02 to zero point zero 0.04.
exactly, exactly. Um, so I think that like I think the short thing that I would say is that like if there is not a medical reason that is backed by evidence and backed by science, say no to induction. Say no
Yeah.
to drugs and say no to an induction.
And if you're wanting to do it because you're like past your due date and you're really excited to meet baby and you're like, I want this, like I'm just ready. I hate being pregnant. I'm so over it. Like no one's pregnant forever. I know you've probably heard that before, but like truly like it will only be a few more days and it will most likely increase the chances of a positive birth experience and just like more simple and like safer outcomes. So if you can avoid it, if it's just that impatience, like just try and wait. Watch a funny
Yeah.
movie, laugh really hard. That might help.
If you found today's episode valuable, show us by leaving a 5-star review and be sure to follow us wherever you listen to podcasts.
The best way that you can support us is by sharing Notes on Arrival with your friends and family. So send this episode link to someone that you love.